All right, welcome friends to the third episode of Venture Forward Together, an interview series highlighting the work and stories of colleagues in the social impact and sustainability fields. We are Danielle Doza and Victoria Avi of Venture Forward Strategies, a consulting firm helping companies make a more positive impact in this world through better social and environmental practices. We're based here in Cleveland, Ohio. First, let's check in on each other. Victoria, what is bringing you energy this week?
I had a chance to plant some plants and spend some time in the soil, so that gave me a lot of energy this week. How about you, Danielle?
The sun, literally the sun. Some vitamin D has been giving me energy. It's warmed up. It's feeling a little bit more, like the end of spring and summer. So it's been nice to just be outside and soak in some of that sun.
That's awesome. Thanks for sharing. So our guest today is my friend, Dr. Aparna Bole, the Director of Community Integration at University Hospitals Rainbow Babies and Children. Aparna is a guiding voice in our community for action in environmental sustainability and pediatrics public health. She serves on the American Academy of Pediatrics Council on Environmental Health Executive Committee and the boards of Healthcare Without Harm, Midtown Cleveland, and many more, I think. Aparna's commitment to integrating sustainability in her work and life is truly inspiring. Thank you for being here with us today. Aparna, can you introduce yourself and share more about your background and let us know what is giving you hope this week, and also how you and your family are managing during this difficult time?
Sure, thank you. It's nice to be here. I appreciate your having me. I'm a general pediatrician. I practice primary care at the Rainbow Center for Women and Children here in Midtown Cleveland. And my passion is in environmental health advocacy, especially as it relates to the intersection between sustainability and pediatric public health, and especially as it relates to environmental justice and health equity. So some of my advocacy locally and regionally relates to issues that are really important in Cleveland, like lead poisoning prevention in children. I care a lot about safer chemicals, safer housing. I'm especially interested in issues around urban planning, healthy transportation, sustainable and vibrant urban development, air quality, some of those macro environmental issues that relate to pediatric environmental health, clean air, climate action, and especially just how that applies kind of in practice in our local community. So those are some of the advocacy issues that I'm most interested in. And I started my medical career as a sustainability professional in addition to being a practicing clinician. I did a lot of work at UH related to sustainable operations, and I'm continuing that work as part of Healthcare Without Harm, which we can talk about a little bit later, but a network of hospitals that is focused on sustainability in the health sector. And you asked what's giving me hope this week. That's a really good question. These are definitely challenging times. And I think as an environmental health advocate, it is quite honestly disheartening to see that right now in the policy arena and the regulatory arena, we're seeing a lot of disturbing rollbacks of some essential environmental protections at the federal level, which feels really disconnected with what we ought to be learning from the COVID-19 pandemic. It's really sort of the opposite of what we should be doing in terms of investing in clean air and public health. But I guess what's making me feel hopeful is I think that first, I think that we are developing a real shared consciousness about how COVID recovery and climate action are really aligned. I think that the COVID pandemic has shed light on some longstanding public health and environmental health issues that we'll be able to, I think, learn from and act on as we emerge from this.
I see a little person peeking out behind you.
And how's your family doing, Aparna?
We're all doing well, including the one that's crawling on the floor right now. We're hanging in there. I think that, one of the challenges of this moment, I think too, especially for someone who is kind of an urbanist like I am, I care a lot about life in cities. I think that the ability to maintain social networks during a time of physical distancing is challenging. And I think that's especially hard for children. So I think as a pediatrician and as an urban health advocate, that's something that is really on my mind as I watch my own family experience the pandemic response.
Yeah. and my family members also in another room, and all of these
like our new
distractions.
reality. It's
Right.
a glimpse into people's, sometimes comical in my case, glimpse into people's personal space. So.
So I know you kind of touched on it a little bit, but what else is shifting for you in your life, in your career during this time?
Yeah, I think one of the things I was talking about yesterday with a friend is that after the first several weeks of this stunning kind of experience of the pandemic response, one of the things I'm experiencing now is this feeling that my professional life is being distilled into its really essential parts. So, like, I feel that the work that I'm doing feels really meaningful. A lot of the time-intensive commitments of meetings that maybe didn't have to happen are cut out from our lives now. So in one sense, I definitely feel like my time is more focused on the most meaningful aspects of my work, which I really appreciate. I think thinking about framing environmental health advocacy in a COVID recovery kind of frame is really important right now. I definitely also have a lot of concerns about some of the children and families who already were vulnerable to environmental and social stressors before the pandemic, and now the pandemic response, I think, has really challenged those families. So I worry a lot about the kids who've had lapsed primary care, who maybe their mental health care has lapsed, families with housing and food insecurity that's been exacerbated by the response. I think this whole crisis is really uncovering some pre-existing inequities that we've known about, but I think have thrown into stark relief for people who maybe weren't so far in the trenches. So I hope what that means is that we'll emerge with a sense of renewed commitment to addressing those inequities. But I think in the moment, one of the things that I'm worried about is just the day-to-day impacts on some of the kids that were already suffering before the pandemic.
Mm-hmm.
So we definitely want to talk about the intersections of healthcare and sustainability. I'm really excited to talk to you about that today. I think it's pretty unique. And we'd love to hear if you can share an example of something in your work that has worked well in regards to kind of that intersection, and or something that has failed in that area.
Do you mean like a tactic or
Yeah, right. Could be a strategy, a project, or some sort of approach you had to some sort of healthcare sustainability issue.
Yeah, I mean, I think in healthcare, there's enormous pressure to operate more efficiently in some respects because we have such thin operating margins. So I think framing sustainability issues like energy efficiency in the language of operating efficiency is really helpful, especially because the kinds of investments you need to make to increase energy efficiency or other kinds of sustainable operations in healthcare are ways to be more efficient without affecting things like nursing to patient ratios or staffing. I mean, these are investments that save dollars without having to make those tough compromises. So I think that's one important sort of tactical consideration in healthcare. I think also the issue of resilience is really important in healthcare, especially now. I mean, we've seen that resilience of medical supply chains has been really threatened by the pandemic. So I think that that understanding how healthcare needs to be part of the fabric of a resilient community in the face of climate change is really important too, and that's really resonating in healthcare. So I think those are a couple sort of topical considerations in healthcare sustainability that really are in line with our mission and maybe a little bit different than in other sectors.
Mm-hmm. So building off the kind of resilient communities, so you're now on the board of Midtown Cleveland, which is a community development corporation. The healthcare office you work at, or the new hospital, is located in that community. So what is your interest and how do you see your work growing in urban health? And what are you working on now?
that project, being part of the design and opening of the Rainbow Center where I now practice, has been pretty gratifying, and is one of the reasons why I'm so interested in what's happening in Midtown, and I'm so excited about the development happening there. I think, it was really an amazing opportunity to be part of planning that facility in a part of Cleveland that is undergoing such rapid changes and has been historically disinvested, discriminated against, afflicted by blight. There's so many issues that were happening in that neighborhood that are derived from racist housing policies and redlining, and to be able to have an opportunity to reinvest in that community where so many of our patients live or have roots was, I think, really, really rewarding. And so to be able to think about green building and sustainable design in the context of a community investment and not just a building was really important. And it got me thinking a lot about investments in transportation and street infrastructure and outdoor spaces and safe places for kids to walk and play, all related to this building project. So that was really exciting for me. And as far as urban health is concerned, I think, I'm really looking forward to staying engaged in the work of Midtown Cleveland, sort of leveraging the community outreach and partnerships developed through the design of the Rainbow Center to help make sure that community residents are at the table in designing the future of Midtown. And then beyond that, I'm really interested in like some of the research and advocacy surrounding urban planning and park space and some of those issues that the pediatric community is getting more involved with. I'm working on a policy statement revision for the American Academy of Pediatrics that relates to urban planning and child health. And so it's given me a great opportunity to look at the literature on that topic, to meet others who are doing research or advocacy related to equitable and sustainable urban design and child health in other parts of the country.
Oh, that's great. Yeah, can you share a little bit more about your work, with the Healthcare Without Harm and Council on Environmental Health, and kind of how you got connected with them, and maybe other national landscape work, things you're working on in the national landscape?
Sure. Healthcare Without Harm is a wonderful organization of hospitals and health systems, both in the United States and globally, focused on creating a more sustainable and just healthcare sector. And there's sort of a lot to say about that. I mean, I think the fact that health is in our mission and that the externalities we create in our operations sometimes go against our mission, it leaves us with a really unique obligation to be leaders in the environmental space as an industry. So if the global healthcare sector were a country, it would be in the top 10 or top 5 even of greenhouse gas emitters in the world. And the US healthcare sector alone represents a huge proportion of that. So it's a huge, I think, opportunity for advocacy and leadership. And I think we have an obligation to do that. So that's really what Healthcare Without Harm is focused on. And it's not just about how we run our hospitals in terms of like having energy efficient spaces or energy efficient equipment. It is a part of it. That is a part of it, but it's also like, how do we manage our hiring practices? How do we lean into our role as an anchor institution? Too often healthcare systems are sort of these ivory towers that are right in the middle of neighborhoods that have historically been disinvested. And so you have this incredible and really disturbing sort of dichotomy where some of the most challenging health outcomes and negative health outcomes in a community are concentrated in neighborhoods that are actually proximate to excellent healthcare institutions. You see that in Cleveland, you see it in cities all over the country. And I think that's partially why healthcare systems are wanting to increasingly lean into their role as anchor institutions to be able to leverage our operating dollars, our purchasing dollars, our hiring capacity to equitably build wealth in a sustainable way in the communities that we serve, and to be really intentional about that. And that's part of sustainability in healthcare too. So that's something that Healthcare Without Harm is really interested in as an organization, and a growing number of our members are working together to figure out how to do that.
Mm-hmm.
Yeah.
Aparna, how could individuals contribute to that mission, whether to advance it or support it? If right now I'm asking myself a question, how can I be part of that? How could I help and contribute?
Well, I think that, anchor institutions aren't just healthcare systems. There are universities, other institutions that aren't going anywhere that are really rooted in a community. And I think we rely on community members to be part of the process of building a network like that. I mean, I'm thinking of the Greater University Circle Initiative here in Cleveland. But as I was reflecting about that question, I think the healthcare sector has a huge opportunity to make changes in the way we operate today. There are also some systems issues that relate to how healthcare is set up in this country, that there are some inherent tensions in our healthcare system and the mission of sustainable healthcare. And what I'm thinking about is, right now in a fee-for-service healthcare model, we are incentivized to go out and look for more revenue in new places. You see places like Cleveland which is a highly competitive healthcare market with, multiple identical megaplexes out in the exurbs, from all of our competing healthcare systems, all on the four corners of the same block, maybe with duplicative services, because we're all competing for the same commercially insured revenue, quite honestly. And so you can put as many solar panels as you want on those buildings and install your stormwater, management and make them energy efficient. But as long as we have this overbuilt system that has duplication of services, that is more about seeking new revenue than investing in prevention, we'll never have a sustainable healthcare system. And I think everything I'm talking about is just, fussing at the margins and not really fixing the root of the problem. So when you ask, like, what can people do, what can you do, what can advocates do, I think it's really important to understand that the relationship between advocacy for more value-based healthcare that rewards prevention, where you get paid for keeping people well instead of treating people who are sick, that avenue of advocacy and sustainability in healthcare are intimately related. And I definitely don't think you can have the latter without the former. Mm-hmm. So as an advocate, I think it's really important to understand that. And I think we can, especially coming out of this pandemic where access to healthcare and the resilience of the healthcare system is being really questioned, appreciating how having more reliable access to healthcare that includes investment in prevention is going to be incredibly important. And sustainability in healthcare requires that.
Yeah, thanks for sharing that. I'm watching the time. I want to make sure we have enough time to do the 4 questions that we ask all of the guests, if you're open to that. So the first one is, who inspires you?
There are a lot of people who inspire me. I think today, one of the things that comes to mind is that it's been incredible to see how many young people are playing a leadership role in advocacy related to climate action, but also in other areas that are so important in pediatric health, thinking about like gun violence prevention, health equity, issues around systemic racism and health disparities, and climate action. I was thinking of the youth climate advocates who have done such an amazing job of building a movement that's really diverse and representative and are taking the reins and demanding a healthier future for themselves and their peers. I think that's incredibly inspiring, and it makes me feel called to do better myself as an advocate, to watch these teenagers and even younger lead in a way that is just astonishing, really.
Mm-hmm. Yeah, I was going to say, I have a kind of a build-off question, speaking of younger people, maybe not teenagers, but when someone's in med school, I'm assuming sustainability is not typically a topic that is talked about. Do you think that could be something integrated into medical education moving forward, whether it's health equity, environmental justice?
I think increasingly those topics are being addressed because medical students are demanding it. It's really our new generation of clinicians who I think are demanding a shift towards thinking about these issues and being taught about these issues. There's a relatively new group that is wonderful. It's called Medical Students for a Sustainable Future. They released a beautiful video for Earth Day. They are building an incredible network of medical students who are advocates, but also demanding more education about climate change and health and healthcare sustainability in their institutions. actually was just part of a virtual medical school course about climate change and health, where many medical students are having to learn virtually right now. And so we turned it into an opportunity. One of my colleagues organized this incredible virtual course where faculty from all over were talking about climate change and health, and my piece was on healthcare sustainability. So I actually think, driven by medical student leadership, there is a lot more of that happening in medical education. And it's incredibly gratifying for me, because I felt when I was a medical student to be definitely grateful for advocates who had come before me, but within my world of medical school, felt a little bit like a lone voice, looking for allies, and it wasn't always easy to do that. I was kind of like finding my community was not easy, and finding mentorship was not easy. And it looks to me like with this groundswell of medical student advocacy and their enthusiasm about building a network of mentors, it's really different now. And it's not like it was that long ago. So this is a very quick sea change in our discipline, which is really wonderful to see.
Oh, yeah, that's exciting. Thanks.
We'll add all those links that you mentioned to the groups in the blog. So if people are interested in following up on those groups and learning more, they can.
Yeah, the Medical Students for a Sustainable Future link, and I can send you some links to Healthcare Without Harm resources as well, because there's some really wonderful material on there too.
And actually, that might be the answer to the next question. What is your favorite sustainability or social impact book or resource?
Yeah, I mean, I think my mind is on healthcare sustainability, so I'm thinking about Healthcare Without Harm resources. There's facts and figures, but also inspiring pieces that Healthcare Without Harm has put out. There's a video vignette that I think does a really nice job of telling the Healthcare Without Harm story, the healthcare sustainability story. It's at donoharmstory.org. And I'm also thinking about some of the material that the American Academy of Pediatrics has published. For example, our policy statement on climate change and child health is a great resource, because it gives some scientific background and evidence around the urgency of climate action for child health. And I think resources like that are also really helpful in engaging healthcare professionals in climate action, because it's our medical professional society. It has like a special kind of credibility in our community, in a way that maybe like an environmental group or a sustainability group may not. It really speaks to a practicing clinician. And so those resources are really helpful to me, the Global Climate Change and Children's Health resource in particular.
That's great. Thanks for sharing. What energizes you in your work?
I feel really grateful that I'm able to both practice medicine and act as an advocate. Different forks in the road, I've wondered about that. Like, should I sustain both? Can I sustain both? And I'm really glad to be able to do that right now. What energizes me is that I get to actually see kids in my practice when I'm there in clinic, and then I'm able to sort of build that understanding that I have from working directly with patients and families into my advocacy. I'm just thinking about last week had an opportunity to testify at a virtual EPA hearing about the National Ambient Air Quality Standards. And I was able to share how particulate air pollution impacts my patients every day. And I think it gives a different kind of energy and resonance to my work as an advocate, to be able to really relate to real human beings, real kids that I care about, that I've gotten to know over their lifetimes. I have kids I've taken care of since they were babies. And I just think it gives an immediacy to environmental health advocacy that I wouldn't have if I didn't have those relationships.
That's beautiful.
So that's probably where my energy most from right now.
And the last question is, what do you do to restore yourself?
Well, I love being outside, and so spending time outdoors with my family is probably the most restorative activity that I get to participate in. Of course, I think about like access to outdoor spaces and parks being such an issue right now too, with so many people being home, and not everyone has that privilege. But I'm lucky to have a place where I can go outside. I can sit outside with a book. I love to read, and I love to just be disconnected and in the sunshine. And so I'm fortunate to have that opportunity.
Aparna, is there anything else you would like to share with us? Anything else that's top of mind?
I don't don't think so. I guess I will just say that I think in this time of physical distancing and at a time where there are many frustrations in being an environmental health advocate from a policy perspective, I'm even more appreciative of the virtual connections with allies, champions who are still fighting the good fight on environmental health and health equity and environmental justice. So that sense of solidarity that I have with colleagues is another thing that is really giving me energy right now, energy and hope. So being able to either virtually or over FaceTime, or just that feeling that we have a network of people all in the fight together is really important. And I don't think I've ever felt it so acutely as now when we don't have the physical connections that we used to.
Mm-hmm. Likewise, yeah. The tribe is still here.
Yes, it's very meaningful. I think last week I had a 2-day multi-hour Zoom meeting with environmental health, pediatric environmental health advocates who serve on my council on environmental health with me. And it was definitely tiring, but just to be together, to remind ourselves that we're in it together, people all over the country, West Coast, East Coast, Puerto Rico, it was pretty great. So it's definitely giving me energy right now.
It is great.
Yeah, well, we're so grateful for you, for your time, for your work, for your passion. And I'm so honored to be your friend. And thank you so much for what you shared today. And can't wait till I can see you in person, maybe give you a hug.
That would be great. It was really nice chatting with you guys. Thank you. And thanks for tolerating the interruptions.
Oh, it was great.
Oh, no worries.
Thanks, Aparna.
Right.
Bye-bye.
Thank you. Bye.
That was a great conversation. I'm definitely thankful to talk with Aparna today, and just reflecting on something that resonated with me, especially during this time, is how everyone is kind of stuck at home, and to have access to green space is so important. And I think that directly links to environmental health. If people do not have access to that green space to get outside, their physical and mental health are going to be affected by that. So I'm thinking about how I can advocate for much more green space in our city.
Mm-hmm. Yes, it was so inspiring. And my takeaway from our conversation with Aparna Bole is nature is a healer. All the people we talked to so far mentioned the same thing. What restores them is nature. Every time, Danielle, you and I share what gives us hope, it's very often nature related. So that's my takeaway. That's the trend that I'm seeing.
Mm-hmm. Well, thank you everyone out there for listening or watching. We hope you enjoyed the conversation. I think it's really important to think about the intersections of healthcare and sustainability. So this will be certainly a growing topic, and we hope to revisit it one day. But have a great day, everyone.